We would like to invite Mr. Ippei Tsuruga to provide us with opening remarks. To Mr. Ippei Tsuruga, the floor is yours.
Selamat pagi, Bapak, Bu. We had a meeting in May 7th and we discussed pension issues. That is a very hot topic in this country. Do you have a headset in case if you have difficulties understanding my broken English? Yeah, please. So this is a part of Bappenas, Indonesian government and the ILO's joint effort as part of the Global Accelerator Initiative. And this is a series of meeting, consultation workshop. But for the ILO, this is, I think, the very first tripartite meeting ever in Indonesia on the long-term care insurance in the ILO history. So this is a very important meeting, tripartite meeting for us also. But before going in detail, I would like to thank Palifis and also Bapena's team to organize this together with our team. And Mr. Yonemaru from JICA to present here, and Dr. Kisha, Dr. Ruri to present the survey today, and also Ruby from Ministry of Health, if I understand correctly. And then also Yuta, my colleague, Tseki from Bangkok and Malaysia to join us. And as also we will have Dr. Joel from Singapore and Dr. Suman from Korea online today. So, ladies and gentlemen, I would like to start by probably talk about my family histories on the care as usual. I talk about my grandfather's history in May 7th, and I said he was 98 years old, and now he is 99 and still healthy. That is a good sign. But at the same time, the rest of family members will have to take care of him. That's another side. I was born in a small village with the 6,000 population with the 30,000 cows and cattle. And main industry is agriculture, farming. And my grandfather was a full-time self-employed farmer. And both my parents are working for agriculture cooperatives for the entire life. And then they retired. All of them still alive, fortunately. My parents are both 75 years old, and my grandfather is still alive, 9 years old. My cousin is a single daughter, and my cousin's father and mother, father passed away, and mother still alive, but she's Alzheimer at the age 75. So she needs also full-time daycare. And my grandfathers need care at the facilities, public facilities organized by the city council, actually town, 6,000 people, so it's a village actually. My parents are still healthy, but not wealthy. They're just, we are coming from the ordinary family background. And probably I'm only the one who studied in the university from my town. That's the background of my town. My grandfather is still paying social security contributions for JKN in Japan. Long-term care insurance he's paying. He's also paying out-of-pocket expenses because there's a co-payment for the health system in Japan. He's paying also rent, sewa in Bahasa Indonesia for the long-term care facilities. So he has a regular income and he is paying his food, rent, everything. So my parents don't have to pay him because they also need income from their own pension. Grandson, I'm not paying anything to them. I'm getting money from them sometimes because they have a regular income from pensions. So that's how my family history. I visited in Yogyakarta together with the UGM team led by Kisha in June as part of our household survey in Yogyakarta. I forgot the name, Probolingo, am I correct? Near the airport. I cannot pronounce well. Okay, sorry, I cannot pronounce well. So near the new airport in Yogyakarta, there is a rice farming communities, right? As you may know. So it looks like my village, actually. So I visited one of them, 2 days, 10 households, and although most of them are basically doing farming together with the communities, their regular income was just 800,000 rupiah per month. Some of them, okay? They're receiving bantuan sosial, because they are categorized as a poor households. But at the same time, they are taking care of their parents. Their parents are healthy and old, but probably some Alzheimer or high blood pressure, they have a problem. They need care. They need someone to cook. They need someone to help them walk. They need someone to take them to the hospital regularly. So the old parents are taking care of older grandfathers, and the children are working in Yogyakarta main city. So that was a family composition without the government support. Probably they only had a JKN, but they didn't have any kind of public care support. So I think this is where the issue exists and what we need to discuss today. Before I close my remarks, I would like to recap the demographic situation in my generation in Japan. I was born at the middle of demographic bonus period of in Japanese time, the best time in the Japanese history, 1980s. And I grew up after Japan ended demographic bonus. So Indonesia today is the time when I was born, in my view. Demographers may complain, but more or less it's a period what I experienced. So the children who born today will probably experience very similar pathway in their life cycle, just like me in Japan. That's my feeling. So I know what will happen if that's true in Indonesia. This generation, our generation, you will take care of your parents because your parents will most likely live up to 80 years old, 90 years old, most likely. And your children will also take care of you and your grandparents, their grandparents, because you and your parents will be still healthy in the future without income. And your children's generations will become 40 years old. And then they will have to think, maybe I have to go back to the village and then look for a job. Let's quit the job in Yogyakarta or Jakarta. That was my generation in Japan. That may happen here too if people don't have a pension. And then children will have to take you to the hospital, take your grandparents to the hospital, and help you take a bath at the end. And they may have to give up their career if there are no public supports. That's my feeling. So we need not only long-term care insurance to provide discounts for the care services, we also need good JKN system to provide a free or discounted healthcare services. We also need regular income for old people. That is called pension, because at the end they may have to pay co-payment for health and non-health related long-term care services. So this is one entrance. Long-term care discussion is, I think, just one entry point for all these comprehensive issues in Indonesia. Last but not least, I would like to highlight, as long as I understand the prolegnas, the parliament has already scheduled to revise the social security law, SGSN, by 2029. That's my understanding from their website. If Indonesia would like to take it seriously and then establish long-term care insurance and the universal pension schemes. I understand the SJSN revision must include these two programs. That's my understanding. And then the momentum is there. And then I hope this series of meeting on pension, long-term care insurance will probably or hopefully provide the really good evidence and insights to these SJSN law revisions so that this will become reality instead of just at the level of awareness raising. So we don't want to do awareness raising here, but we want to kick off the serious policy dialogues with the workers, employers, and the government representatives. Thank you very much for listening, and thank you very much for your participation.
Thank you, Mr. Ippei Tsuruga, for the opening remarks.